Happy Thursday to everyone. So I'm very excited to be here. We're going to be talking about very special subjects for me. We're going to talk about biomolecular core optimization, telomere rescue therapy, and personalized IV therapies. And biomolecular core, it's a term that I came up with after I met Mark Hagen. And Mark Hagen was the rep of Spectracell like 6 years ago. And he came to me with those graphics and talking about intracellular values and monitoring of different micronutrients. And I got fascinated by that. And it kind of reminds me that trillions of biochemical reactions are happening in our body, and they depend on really all these micronutrients. If we want what I decided to call biomolecular core, that are all these reactions, we want that working 100%. We need to have a micronutrient profiling in 100%. And after all these years of using Spectracell micronutrient testing and seeing how impact my patients' health when I utilize the information I get from it, and when I optimize what I decided to call the biomolecular core, I realized how important it is to know what we're treating in terms of nutrition. And one of those awakening moments and learning moments that I have came through Carlos. And I promised him I was going to mention him, so I have his permission. Carlos is a patient who came to me 5 years ago, and he was seeing Dr. Permuter. He is, in fact, in Dr. Permuter's book, Grain Brain. He has multiple sclerosis, and he's a trooper. He's been fighting with it, and he's been doing all kind of things to get better, and he's a great guy. As I say, he's a trooper. But he was being treated with Dr. Permuter's protocols that, as we know, are really great for neurodegenerative processes, Parkinson's, so high dose of glutathione, 3 times a week, 2,000 milligrams of glutathione IV. And at the beginning, he was doing great, and slowly the protocol started making him sick. And he tried to get answers from the clinic. I think Dr. Permuter by that time was in the process of not practicing that much there. So he got frustrated. He went to Colombia because he's from Colombia, and he got some blood work, and his vitamin C was very low. So somebody mentioned that I was doing IV therapy, but at that time, I was recently started because I've been doing IV therapies for 5 years, and it's just when Carlos came to me, very close to the time that Mark Hagen introduced me to Spectracell as well. And I saw the ascorbic acid that was checked in serum in Colombia, as I say, and it was like very low despite he was eating great amount of fruits and vegetables and all that. And I thought, well, this guy is getting huge dose of glutathione, and the redox cycle used also ascorbic acid to reduce glutathione, get it back to the cycle. So it makes sense that his ascorbic acid was depleted, and I told him that I wanted to treat him with vitamin C, but I wanted to do a full micronutrient testing before to make sure that we give him everything he was missing. As I say that to him, I realized that what I was trying to build, that it was kind of what everybody else around me was building, that it was an IV therapy practice based on diagnosis and symptoms, were not the right way to go. And I decided to go for a personalized approach then. So since then, I've been doing micronutrient or performing micronutrient testing for most of my patients before I start them on therapy. Some of them don't go for the micronutrient immediately. Some of them want the therapy first. They get to feel better at the beginning, and then they go for the micronutrient testing. Most of those patients are trying to save some money, but at the end, when they get the micronutrient and we personalize the therapy based on that, they realize the importance of doing that. So I do think that, in my opinion, after doing all these years IV therapy, personalized and monitoring through biomolecular and micronutrient testing, I realized that it shouldn't be another way to practice this. We're utilizing high dose of vitamins, supratherapeutic dose of vitamins, and by doing that, we're opening pathways that have been shut down. Like in your biomolecular core, we have pathways working, as I say, trillion of pathways that are trying to keep you 100%. But if you have micronutrient, as most of us have micronutrient imbalance, some of those pathways start slowing down or shutting down. And when that happens, we're not 100% anymore. And as these changes happen, we blame aging, we blame stress, we blame multiple things. And depending on your genes, it manifests with different symptoms that we label with different diagnoses. But the same biomolecular imbalance can cause one problem in some people and another problem in some others. But the treatment would be kind of the same. So by personalizing the therapy, you prevent that problem. And you're really working on fixing the problem from the source, from the root cause. So on the other hand, if we are giving high dose of vitamins and we're opening some pathways, new imbalances are going to start developing. And you're going to see some examples I'm going to give you. But when that happens, then patients, the formula make them feel better. But then long term, it's not going to work. Or like in a year, you need to change the formula. Or in a few months. So if we don't monitor, we don't realize that new imbalances are developing, because by those pathways that are starting to work now, you create some demand mismatch in other nutrients that were okay before. So this is, in fact, for me, this is like a major groundbreaking finding, and it's been very instrumental in my practice. And I have to be grateful to have encountered this testing and being able to practice what I call tomorrow's medicine today. And tomorrow's medicine is a personalized approach. And the micronutrient testing with other genetic testing are really instrumental on these and are really important. One of the things that make me choose this kind of technology is that the fact that they use lymphocytes instead of other cells. Lymphocytes are not only part of our immune system, but are also very similar to the rest of the cells in our body. There is other tests that utilize red blood cells. And in my opinion, I think red blood cells are not as similar to other cells than lymphocytes. So, and I have tried before that testing, and I don't feel it works as good as this one. And having these tests that is kind of the hemoglobin A1C that give you 35 different nutrients has been really, really helpful to me and to the progress of my protocols and to help my patients throughout these last years of practice that I've been doing this kind of approach. So I'm very grateful that I encountered this technology. So definitely it's a very exciting time to be a doctor, in my opinion. I mean, we're moving from a diagnosis-centered approach to a patient-centered approach. We're moving from standard of care to personalized care. There is more room for innovation, for using creativity. I went to medical school, and I remember everything is inside the box. Don't go out because you're liable. And I do think that at this point, with everything that is coming along with the technological progress that we're living, it's really great to be part of it. And we're moving to a precision medicine approach instead of the typical evidence medicine approach that is going to be revolutionizing the way that we even do research in medicine. And I'm not saying that medicine was not good before. We know that it's great. It's been great. It has increased lifespan for people, life expectancy. But one of the challenges that we're facing is that people are living longer, but they're not living better. So life expectancy, lifespan, and health span are concepts that we all have to be very aware of. And the difference is that life expectancy is the statistical number, the number of years of a person is expected to live. Lifespan is the maximum number of years that a person have lived within a society. So in America, the life expectancy is 79 years old. The lifespan is 114 years old because there is a woman who lived up to that age in California. Health span is the length of time that the person is healthy, not just alive. And this is such an important concept because it talks about quality of life, of those extra years that we're gaining. And what we're seeing in America is that the health expectancy is 63 and the life expectancy is 79. When our goal should be healthy longevity, so have patients living longer but better. And this is what has been happening along different countries in the world over the last few years. So if you see up to like the 1,990, we see that there was an increase on healthy life expectancy. And then if you look at the dark blue area, is the increase in healthy life expectancy after the 90s, up to 2013. So then you see the pink and the red, and it's the same thing. Additional years, but these years are burdened by sickness. These people are ill. So we have gained some expectancy, but it seems to be driven by not really great quality of life. So on average, humans live approximately 20% of their life burdened by sickness in the last, today and in the last few years. And this is something that you see along the countries and even in America where we should not be seeing this because we have resources. Trying to get our patients live longer also has affected doctors' health, and this is something that I have done a lot of research. So we have to make our healthcare system healthier, not only for our patients, but for our doctors. So that's why it's so important and so exciting to learn about new concepts that are coming up and help us to monitor and learn more about aging, how to prevent it, and how to help people to age healthier and younger, which sounds a little crazy, but feeling healthier means to feel younger, in my opinion, for what most of my patients kind of want to feel. So one of the before, when I was trying to get my patients to feel better with and to work on their healthy aging and all that, because I've been always into wellness and lifestyle and nutrition, I encountered Elizabeth Blackburn work on telomeres. And I was working by that time in a concept that I call BioH, because I felt it was very empowering for people to understand that if they were managing stress and eating the right things and exercising, despite they didn't have control over the chronological age, they did have control over the biological age. So when I found that there was a marker to measure biological age beside the survey, I created a survey and a system that the patients could go in and get kind of an approximation of their biological age by their lifestyle and how healthier they were. So when I found these, I love it because it was kind of in paper that I could give them a number that it was not only based on their lifestyle, but it was something that we could measure. And it was based on telomeres, and as most of you know, telomeres are the end caps of the chromosomes and protect DNA information and control aging. So long telomeres have been linked to increased longevity and health span, and short telomeres have been linked to decreased longevity, to decrease functional capacity on those years, to decrease health span, and increased risk of certain age-related disease, such as coronary artery disease, diabetes, and Alzheimer's dementia. So as cells divide over time, telomeres shorten, and eventually cell division stops and cells die. And there is different mechanisms for telomere maintenance. So pretty much if the telomeres are long enough, they can form the T-loop, and these prevent the telomeres to be written as a damaged, broken piece of DNA by the fixing mechanisms for DNA inside of the nucleus of the cell when the cell is trying to duplicate and replicate. So these prevent the telomeres to be written as broken and to have some system trying to fix it that in fact it doesn't fix it. It causes chromosomal dysfunction. But so as long as the telomeres are long, we can create these T-loops and protect the telomeres. Then we have also a sheltering complex that helps the enzyme telomerase to help to keep telomeres long through replication. But we also know today that aging and malnutrition affect the way that this sheltering and telomerase work. So as we age, that's why as we age, our telomeres get shorter. So every time the cell replicates, it might lose a little piece of the telomeres, and that's how they get shorter and shorter. And for this process, it's so important that our sheltering complex and our telomerase can work well, and our DNAs are not oxidized and they're in good health. So that's why nutrition is so important to keep telomeres healthy and long. So there is multiple studies that have linked different nutrients as very important to keep telomeres healthy and to help telomeres to replicate and stay longer. And a big and important piece of this is antioxidants such as vitamin C and glutathione. But as you can see, zinc, different Bs, calcium, manganese, even vitamin D, which doesn't surprise anybody here, are super important to keep telomeres healthy. So different epigenetic mechanisms have been linked to telomere length. Telomere length heritability declines with age. So we inherit the length of our telomeres. Most of us inherit a medium range telomere. So most of us don't have long telomeres from heritability or short telomeres. There is some syndromes that are associated to inherited problems with telomeres. And we'll talk a little bit more about that later. But as we age, heritability starts declining in powers to affect or to influence over our telomeres length. And non-genetic factors that we call epigenetics, environmental factors, nutrition, lifestyle, stress, oxidation, impact our telomeres more than anything else, positively or negatively. So epigenetic mechanisms of telomere dysfunction that has been described in the literature are mainly antioxidant deficiencies and oxidative stress, deficiency in cofactors for DNA synthesis as magnesium, zinc, and copper, deficiency in methylation. Methylation is so important for gene expression and telomere maintenance. And 60%, up to 60% of population have problems with methylation genetically. And when you add that stress, that in modern life nobody has no stress, then methyl donor requirements increase to the point that nobody, even people with the perfect genetic in terms of methylation, can meet the demand. So methyl donors in your diet and in your supplementations are like super important to keep your genes expressed in the best way, to keep some bad genes off, and to keep your telomeres long and healthy and stable. And then niacin, it's another important factor, and the NAD are super important to keep your telomerase working the right way, so we don't lose telomere length control. And as you see, all these mechanisms go, if you have oxidation or you're deficient in cofactors or you have problems with methylation, so we end having the same problem, that is that our telomeres cannot replicate and cannot maintain. And by losing telomeres, we lose years of life and health span. So I'm just going to talk briefly about methylation. I already mentioned, but the methyl group, it's a very small group, but it's so important, and it works in so many different pathways. And it helps us to have enough energy. It helps us to have enough serotonin and be happy, to have enough SAMI, that it's an important factor to keep our neurotransmitters stable, and glutathione, purines, keep our immune system well, keep our bad genes off and good genes on, and regulation of genetic expression, and also telomere stabilization. As I said, stress is a huge factor because it increases the requirements of methyl donors. And if we don't have enough extra methyl donors when we're under stress, and we have genes that, the genetics that doesn't even help us, so then we have a big problem. And a lot of us are depleted on methyl factors, so it's so important. But we don't want to hypermethylate people either, because by hypermethylating, we also changing the expression of genes, and by changing expression of genes with hypermethylation, sometimes you make genes on that you don't want. So it's very delicate, and one of the things that I check on all my patients is homocysteine and methylmalonic acid, and I monitor that on my patients who are getting therapies, because it's the only way to really adjust therapies and make sure that we're not hurting people long term, but just bringing benefits to them. So, and now we come to a question, and the question is, what happens if you have long telomeres? Because there is a lot of research and controversy around long telomeres and cancer. And this comes from multiple epidemiological studies that has pointed at inherited telomere syndromes with long telomeres or high levels of telomerase increasing risk of cancer and mortality due to those cancers. There is also some inherited telomere syndromes that are related to short telomeres that are also associated with other types of cancer, but in those cases are cancers that the cell turnover is really high, like hematopoietic cancers and gastrointestinal cancers. The inherited long telomere syndromes are more related to lung cancer, brain tumors, and melanoma. So despite inherited long telomere syndromes are associated with decreased mortality, increased longevity, and lower risk of coronary artery disease and Alzheimer's dementia, there is along them, there is a greater risk for some cancers, as I say, and increase of all cancer mortality. However, what happened on the majority of patients who have medium range telomeres, as I say, inherited from their parents, and they have a good behavior, they have a great lifestyle, they manage to handle stress in a positive way, so they control their epigenetic influence. Those patients, they have the same effect in terms of longevity, so they gain years of life, of healthy longevity, in fact, because increase their chance of having a healthy lifestyle and healthy life throughout those years that they have gained, but it also decreases the risk of chronic medical problems associated with aging and combined cancers. And this was a great relief to me, because I have to say that when I saw that what I was seeing in terms of telomeres on my patients, they say, am I doing good to them? I hope so. But after all these years and seeing that epigenetics, that is really what we're doing, we are optimizing nutritional profile on these patients using oral supplementation and IV therapy. This is totally epigenetic. So, and you know, we haven't done those great big randomized studies, but my goal is to get to there eventually. But in the meantime, the observational studies that we have available, the epidemiological studies, seem to support that what we're doing is really good, as long as we're monitoring with tests like Spectracell micronutrient testing. So, and I'm going to talk a little bit about my cases. And before I get started, I want just to show you that when I start using IV micronutrient therapy, I went in a little bit skeptic, because I come from medical school saying, and from a philosophy that if you eat well, you don't need supplementation. And then I start seeing the effect of supplementation in my own life and the life of my patients. And then another patient kind of forced me to go into micronutrient therapy. She was pushing me so much that it was great, intravenous, you have to do it. And I went for training, and then I started using on myself, and I saw such an amazing results. And then I started using with my patients, and I haven't, you know, I'm so grateful I did, because you get results that are like immediate results, fast, and then especially if you're monitoring, you see that those results are impacting the biomolecular core in the right way. Not only that, but you're going to see what happened to my patients that made me even happier in terms of their telomeres. But, you know, studies like these, they didn't personalize the therapy. They used a typical Myers, and this is what they saw. So short-term IV therapy is great, and we know it. They treat once a week for 8 weeks patients with chronic fatigue, and they saw, compared with placebo, that their health status questionnaire improve remarkably. So patients feel better. And they didn't only feel better just during the therapy, but it sustained after the therapy was stopped. Because from week 8 to week 12, the improvement sustained on the patients who was treated, which talk about improving the cell reserve on this patient, in my opinion. And that's what I've seen in my practice too. And I'm going to show you with some cases. So my first case is a 66-year-old female who she's menopause on BHRT. She's a very busy woman, highly functional, founder and CEO of a major corporation. She presented to me for wellness optimization. And her profiling was consistent with homozygous and the 677. That means that her methylation genes she has a mutation there. So she needs big-time methyl donors as we talk. And she has multiple deficiencies in her micronutrient profile, including B12, which didn't surprise me, and B4, as we know her genotype already. So I put her on a protocol based on her deficiencies and oral supplementation as well. I told her to come for IV therapy every 2 to 3 weeks for 6 months, and then I moved her to every 6 weeks. She travels a lot, and she never missed her therapies because she stated she felt great, that her energy increased, that her brain clarity was much better when she got the therapy. She noticed an effect instantly after the first therapy. And she was traveling a lot, and as she traveled a lot, she also noticed that she got very frequent colds, and that stopped after we started therapy. So she felt that was helping her immune system. And people say sometimes how you make your patients compliant of this is not hard because they feel so great. And many of you probably know because some of you might be practicing these, IV therapies, and short term, you get really great results. Patients want it because they feel great. So on this patient, I checked telomeres as part of my protocol, and I noticed that her telomere was 46th percentile. So it was red. And I always tell them that this means that she is chronologically 60 years old, but her telomere age is 66, so her bio age is 66, and patients understand that. And it's very empowering to them too, because then in order to have them changing a lot of their lifestyle, I love this test for that. A year after she came, and this kind of surprised me because this is 2017, January 2017. And I saw that she was green, and I saw that her telo age was 40. So I show her both, and I say, you're doing great. And she was pretty much doing mostly the same in terms of her lifestyle. She was always active, and she was always enjoying her job. She has highly stressful job. So really, by history, what we have changed or introduced in her life is the supplementation. She was not doing great with the oral supplementation, but she was really compliant with the IV. So I kind of got excited, but this was one patient, right? And if you see her micronutrient profiling, I put here as part of it, and you see how she has some red hairs, as I say before, copper and pantotene and B12, and these improve on the next year. And then, her omega-3s were low all along, and that has been linked to short telomeres as well. So I kind of incentivized her to be more compliant with her oral supplementation. She had a lot busy year, so I saw her this year like 4 times, and in 2018 we rechecked her telomeres, and the findings remained the same, and her biomolecular microtesting profiling was almost perfect. So this is the power of kind of what we saw on the Yale study, but in terms of instead of sustaining just the symptoms, we know that the improvement on the biomolecular core and the micronutrient profiling persists, despite patients don't have to have, like, despite they don't have the IV therapy every month, which I think is ideal. I mean, I always tell my patient, I want to load you the first few months, because after I've seen these, I realize I can't give them more often therapies at the beginning. So they start building up the reserve, what I call the reserve, so they understand better. And then as time passes by, they can come less often. And the improvement sustain. And you see that clinically, because at the beginning they say, I feel that it wears off after the second or third week. But then after a few therapies, they feel it lasts longer, up to 3 months. So, and that's exactly what we're seeing in terms of the micronutrient profiling too. So I think that's a proof that what we're doing is a good thing, not only clinically, but paraclinically too. And then if you see what happened with this woman, she definitely was taking better care, and she was more compliant with her supplements, because even her omega-3s improved. So then I have another case, and this one happened to be a very interesting woman too, highly functional, super busy, executive, travels a lot, this time 56 years old. We're on BHRT as well, hormone replacement therapy, bioidentical. This woman presented with a generalized tendinopathy after she took a course of quinolone for a urinary tract infection. And she had kind of symptoms of chronic fatigue, foggy brain, she felt tired, and she's a highly functional woman with a crazy lifestyle. So for her, this was like very, very stressful, because she couldn't perform at the level that she was used, and she has to drag herself in order to do the things that she wanted to do. So her methylation genes, MTHFR status was heterozygous in both. So one, for those who are not doctors here, one was mutated and the other one wasn't. And she had multiple deficiencies on the micronutrient profiling. So I create a therapy, personalized therapy for her based on those deficiencies, and we start the protocol, as I say, very often at the beginning, and then we move her every 8 weeks. She started feeling better, but one of the more dramatic things that we saw was the elongation of her telomeres as well. So she was on the percentile 30, and she moved to the 66. So her telomeres went from being red and below standard for her age to above standard for her age. So her telomere age was 70, despite her chronological age was 55 in 2017. And now that she was 56 in 2018, her telo age was 45. In this process, during this year, she also got adipose-derived stem cell therapy, and I learned something else throughout this, and with other patients that I sent for adipose stem cell harvesting, that when you improve the biomolecular core and the micronutrient profiling in patients, cellular count seems to increase. In fact, in every patient I have sent, to levels that I made the doctors call me and ask me, what are you doing for this patient? Because the cell counts I'm getting from this patient are crazy. And that's been described also in the literature, that if the stem cell niche is really nourishing, then stem cell seems to perform better, and the stem cell count seems to be better when they're, count in the right way. So this is something else that I realized and learned throughout this. But this was her biomolecular profile, and as I say, she had multiple areas where she was deficient or borderline as you see on the red and the black dots here. Some things were okay. And as you see, her omega-3s were perfect. This is a woman who takes all kinds of supplements, and she exercises. She does everything right. And she was doing great up to the time that she got the quinolones. So definitely there was something there that, and then she had multiple life experience that increased her stress level. So there was different factors that affect her and really deplete her biomolecular core to points that even she was taking supplementation by mouth and eating right, she could not meet the demand that she required by the level of stress that she had. And this is just a graphic that I wanted to show you to emphasize, especially for those physicians who are listening and are doing stem cell therapies on patients. Today I work with 2 different stem cell doctors, and I prepare patients to get stem cell therapies. And what we're seeing all along is that patients seem to get better results when they're nutritionally enhanced. And in my opinion, the best way to nutritionally enhance somebody is with IV therapy, especially at the time that we are, that our guts are not the healthiest they can be. Besides, in order to help the gut to get better, in my clinical practice, what I've discovered is that there is nothing better than IV therapy because you're bypassing the gut, you're nourishing every cell of your body, including your intestinal lining. The third case is one of my international patients, and she hates to take pills. And she was 63 when I saw her. Her husband had great telomeres, and he's 10 years older than her. But she was traumatized that her telomeres were below range and even shorter than her husband. So she has some heterozygotes in her methylation genes, and she has multiple deficiencies. I start seeing her every 2 to 3 months because, as I say, she was international. So I didn't see her as often at the beginning. Although she came along, there was a time that I gave her 2 therapies, like 4 or 5 weeks in between. So she got 2 therapies that were very close, and then other therapies were every 8 or 12 weeks. And as you can see here, in 2 years of doing that, her telomeres improved. And as I say, she didn't take the other, like the pills that I recommend and the other things that I say. She didn't change her lifestyle. She just did the IVs every time she came to Miami. So, and this is what we saw on her telomeres. This was her personal life, like this was her micronutrient testing profiling, so low biotin, low Bs, all along these. Her minerals were okay, zinc and copper were okay at that time, but this is how she improved. And you're going to say how she improved with just every 8 weeks IV therapy and not taking much by mouth. I have to say that it's just, I do think that this supratherapeutic dose really increased the reserve. And I really believe that we can spur people to take so many pills and so many supplements. I've seen people who take 20 and 30 pills a day for supplements, like daily supplements. So I think that's crazy, and I think the future is that we're going to be giving patients personalized IV nutritional micronutrient therapy like every 2 or 3 months as a regular preventative program for them. And that's my goal, to get insurance company to do that. And that's where I'm dedicating my research and my publication. So if you see the omega-3s, then you see that she was not really too bad, but she got even worse. So she definitely was not taking the omega-3s. And this is something I tell my patients, I can do whatever with your micronutrient profiling, but please take your omega-3s because that's something that we cannot change giving you IVs. And especially when you open all those pathways, the requirements of omega-3s and regenerate, we're regenerating tissue, we're improving telomeres, so omega-3s requirements increase. So there is a big change on the way that we're treating at least patients in the oncology world, and now we're talking about personalized biomolecular approach in terms of cancer. But I do think that that approach has to be taken to nutritional therapy, to gene therapy, to even antibiotics. So if we give diagnosis to people and we label the same and we think they're all the same and we treat them the same. And when we do the individual biomolecular and genetic evaluation, all those individuals will realize they were not the same, that they have different genes, they have different deficiencies. So when we really pair that, we really treat people the right way. So one therapy doesn't fit all anymore. Understanding this, and after seeing all that, I've been dedicating most of my time to create an app that helped me to create the therapies individualized for my patients. So utilizing artificial intelligence, I'm trying to deliver a patient-centered experience. I'm trying to deliver a patient-centered approach. It gets complicated because you get all this testing, and we're talking about 35 plus different nutrients. And we have to adjust the therapies every 6 months to a year. And we see that other numbers also improve. So if we really want to create data that help us to change the course of medicine and help us to get the medicine we want to offer faster, we really need to work with IT. We really need to incorporate the advance in technology and everything that we have available today that can help us to get there. And I also realized that in order to practice a patient-centered medicine, we need to really measure things that patients care about. I mean, we ask patients so many questions, but they leave the consultation. I see them all the time. They come to me and say, my doctor said I'm fine. I went for my physical, but I feel crappy. My brain is foggy. I feel tired. I'm not sleeping. My blood work looks good. What should I do? So these are the things that I ask my patients about. Because my goal is, most of my patients are healthy. If they're not healthy and they have certain problems, they know what to do already. They're highly intelligent, and most of them are doing. Most of them, they feel too crappy to do it. So as soon as you improve the biomolecular core, you start seeing all these numbers to improve. So as we ask patients, your pain 1 to 10, I ask my patients, how's your energy every day 1 to 10? And how's your mood? And how's your brain clarity? And let me tell you, they love it. It's so empowering to them. And when they see they're improving, they want to do the other things. I don't have to push them anymore. They want to eat better. They feel they have the energy to go and exercise. And they improve their sex drive. They feel more beautiful. So, and every time they come, they tell you, because you force them to think, and as they empower themselves with that improvement, they want to do more. And of course, the testing is super important. And as I say, I mean, you need to use the testing you believe and you understand. For me, Spectracell has been the source for that. It's cutting edge testing. It allowed me to really monitor and customize therapies for my patient. My patients understand it. And I don't know. I don't know what kind of practice I would have if I wouldn't be in touch with Mark Higan that day and start doing Spectracell. So I'm very grateful for that. Then I also think that the concept of BioH is very empowering, and that's what we need to do. We need an empowering approach. If we're doing a patient-centered approach, we need to empower our patients to do the right things, and we need biomarkers that they can understand. Yes, hemoglobin A1C is a good biomarker, but it's not sexy. We need sexy biomarkers. We need to make medicine sexy so people want to do the right thing for themselves. So I think BioH and telomeres are really sexy. I don't know if you agree, but. And then in terms of the therapies, I use the regular things. I just customize it as their patient needs. And if they have local CoQ10, I add. And so, but my main ingredients are based on Myers and Dr. Myers' cocktail. It's just that what I've seen is that when you really balance the dosage by the needs based on the micronutrient profiling of the patient, the results are so much better. And there is less risk of us creating imbalance and bringing long-term problems down the road, especially if we're using, for example, glutathione. There is people who are getting glutathione on a spa, on a hair salon, for beauty, for their skin, that's unacceptable because it can create a lot of problems. So I'm not happy with that, and I'm gonna keep fighting, and I'm gonna keep trying to educate people on the importance of knowing what they're doing with their bodies. And monitoring what they're doing. And yes, I think that we need to take this seriously. It sounds like we have been taking nutrients and vitamins and antioxidants very light, and they're powerful. They're as powerful as drugs, or even more. And we have to do it, of course, responsibly, because as any intervention can cause problems, so we have to monitor, we have to source the highest quality graded products, we have to compound following the regulations to make sure that everything is the right way. But I do think that we have a great chance of reshape the future of medicine utilizing micronutrient and biomolecular therapy. So it's our responsibility to do it and to take it seriously and do it the right way. And we need to be compliant. And the FDA just changed the 797, so November 2018 is when everybody needs to get into this new regulation that say that every therapy has to be prepared under a hood. And my company has been dedicating a lot of time and effort in order to meet all these requirements and beyond, because after all, is our patients safe? And there is a lot of people doing IV therapy in a very irresponsible way. So I encourage you, if you're doing IV therapy, to read the new regulations, to understand the new regulations, and try to find companies that provide you with this kind of beyond regulation quality and superior products. So I think with this, I'm finishing. These are my reference in case that some people are curious and want to read more. I hope that I answer all your questions, and I hope that I encourage you to be excited about what's coming up and be excited about practicing tomorrow's medicine today. Thank you so much. I have a question that Jessica just sent me. how does overnutrition affect telomeres? And I guess overnutrition means if you eat too much. Well, if you eat too much of the bad things, it's not good. If you eat too much of the good things, it's not good neither. Because if you eat too much of green stuff, then you develop thyroid imbalances. So overeating is never good. And that's why it's so important to be responsible when we're using supratherapeutic dose of vitamins. It's like any other therapy. It has to be monitored by a physician who understands what they're doing and under a protocol that has been, tested good enough. And so far I have to tell you, I've been looking in the literature, there is very few people who do what I do, and my goal is to get more and more validation of these protocols, because I do think that I don't know, I think that this is my mission, but I cannot tell you more about obesity, if that's another thing, over nutrition. Obese people have been noticed to have shorter telomere than standard. So that's another proof that eating young is not good for your telomeres. So there is another question here. What do you consider an ideal homocysteine? How much damage is being done if the upper end of the normal range? The ideal numbers of homocysteine I usually like around 5. 5 to 7 is where I try to stay. If you have upper end of normal range, it's usually a sign that your methylation, your methyl donors are not at bay. So I usually increase the amount of methyl donors on patients' therapy. I add methionine and I add more methyl tetrahydrofolate and methylcobalamin. I'm very careful with methyl tetrahydrofolate because it also drops zinc levels if you overdo tetrahydrofolate. So it's something that it needs to be done very carefully, but definitely I would try to bring down the homocysteine on those patients with methyl donors, because it's just a sign that methylation is not where it should be to keep your biomolecular core working 100% and your genes expressing the best way and the best potential they have. There is another question here. Does fasting to be more effective? Does fasting, to be more specific, intermittent fasting affect telomere length? And the answer is yes. There is some studies that have